Welcome to AFD TV. I'm Dr. Steve Samudrella, and I'm here with allergy and asthma specialist, PA, Neil Grossman. Welcome, Neil.
Thank you. Very happy to be here.
Lauren from New York says she has allergies, runny nose, watery eyes, sneezing, and over-the-counter antihistamines doesn't seem to help. What should she do?
There are generally two reasons why those medications are not working for Lauren. The first one would be that she is actually not allergic at all, and all she has are symptoms. The second reason is that she's so allergic that the medications are not enough alone to treat her symptoms. We do a blood test to decide whether or not she is allergic at all, and if she is, what she's allergic to, and how allergic she may be. And then what we do is we add reduction of those very specific exposures as part of her treatment if she is allergic to help with the medications. If she's not allergic to anything, we don't need to keep her on those over-the-counter antihistamines or those over-the-counter allergy medications. We go in another direction completely.
Great. Regina from Georgia says her daughter has asthma attacks every spring and ends up in the ER. What do you recommend?
Up to 90% of children and up to 60% of adults in the United States with asthma have an allergy or more than one allergic trigger. It is by far the #1 trigger for asthma and one that clinicians have some control over. I recommend testing at the earliest possible stage of disease, at the first sign of disease, so that we can control what's causing the symptoms and hopefully they never have to reach the point that they're being admitted to the emergency room.
Great. Roy from Brentwood, Tennessee wants to know, do allergy shots and allergy drops work?
They're very effective. Allergy shots are they're called subcutaneous. They're needles underneath the surface, the top surface of the skin. They inject small amounts of what you're allergic to, and over the course of time, they raise the amounts to help your body begin to fight off what you are sensitive to when you're initially allergy tested. The drops are what's called sublingual immunotherapy. They go underneath the tongue, and the methods are very similar. Larger doses in hopes that eventually you build up a resistance or a tolerance for the things that are causing symptoms. As well, what we do is when we test somebody for allergies and we determine what they're sensitive to, another method is to try to reduce what's causing their symptoms in their environment. So they can go on shots, and some patients we decide all we want to do is reduce their exposure to the dust mites, or to their cat, or to the pollens, or whatever allergen they may test positive to, in hopes that the outcomes will be the same, a less symptomatic patient.
Great. Well, thank you for watching AFD TV, and stay tuned for more great information.
The preceding advice provided in this video is informational and strictly the opinions of Dr. Samudrella and AFD Clinics. For a more accurate medical opinion of your personal health, please consult your primary care physician or visit one of AFD's clinics today.